management of skeletal class 2 malrelation during growth spurt is very essential to achieve a skeletal class 1 maxillomandibular relationship. In this short video, we are going to discuss on management of skeletal class 2 in interceptive orthodontics with various myofunctional and orthopedic appliances. When we consider a skeletal class 2, we come across the common features of skeletal class 2 such as convex profile, average to acute nasolabial angle, incompetent lips, increased overjet, deep bite, deep mentolabial sulcus and deficient chin. So these are the common clinical features of a skeletal class 2. Now, when we look into a skeletal class 2, we should certainly know what are the common skeletal class 2 component. One of the common skeletal class 2 component is orthognathic maxilla and retrognathic mandible. So when we come across an orthognathic maxilla with a retrognathic mandible, our target is to correct the retrognathic mandible by the use of myofunctional appliance. The common myofunctional appliance like twin block, Frankel, Herbst appliance, advancing, forces, we get lot of myofunctional appliances. And one of the common supplemental diagnostic aid is lateral cuff. Also, we come across FTO, functional treatment objective, as another supplemental diagnostic aid. What is functional treatment objective? When we ask the patient to stand in natural head position and slowly advance the mandible either to edge to edge or with 1 mm orget, there will be an improvement in facial profile on posturing the mandible forward in a definite indication to myofunctional appliance for the treatment of retrognathic mandible. So, when the patient is standing in natural head position and when we advise the patient to slowly advance the mandible either to edge or to 1 mm overjet, if we feel there is an improvement in facial profile from a skeletal class 2, the patient gets a very acceptable profile. It's a definite indication it is a case of skeletal class 2 with orthognathic maxilla and retrognathic mandible which need mandibular advancement with myofunctional appliance. It is during the pre-pubertal growth spurt we commonly practice a myofunctional appliance, that is for boys between the age of 14 to 16 and girls between the age of 11 to 13 years. This is the timing for myofunctional appliance. And it is during mixed dentition growth spurt we commonly practice the orthopedic appliances, that is for boys between the age of 8 to 11 years and girls between the age of 7 to 9 years. The common orthopedic appliance we use for skeletal class 2 correction is a headgear, and the common myofunctional appliance, as I mentioned earlier, is a twin block. We also use advancing, forces, power scope, Frankel appliance are all myofunctional appliances. So this is a twin block, this is a Herbst appliance, advancing, and all these myofunctional appliances are used during the growth spurt, that is the pre-pubertal growth spurt. The second common skeletal class 2 component is prognathic maxilla and orthognathic mandible. When we get a case of prognathic maxilla with orthognathic mandible, our treatment is to restrict and redirect the growth of maxilla. So, as I mentioned, we commonly are going to use the orthopedic appliance, that is a headgear. We also get FTO or functional treatment objective negative. That means to say, when we ask the patient to stand in natural head position and advise the patient to advance the mandible, we will not get an acceptable profile, which indicates this is a negative FTO, and we need to treat the prognathic maxilla with the help of orthopedic appliance, that is a headgear. As I mentioned earlier, it is during the mixed dentition growth spurt girls of 7 to 9 and boys of 8 to 11, we commonly use the orthopedic appliance, that is the headgear. So this is the headgear case. which has been treated for prognathic maxilla. The third component of skeletal class 2 is when we have vertical maxillary excess. We get a vertical maxillary excess here. So what we commonly find is when we have the third component of vertical maxillary excess, we get an increased lower anterior facial height with gummy smile, which again is treated with the help of orthopedic appliance, that is the headgear. So our target is to restrict and redirect the growth of maxilla with the help of orthopedic appliance, that is a headgear. And we have the fourth component, that is a combination problem. We have prognathic maxilla with retrognathic mandible, which is treated with a combination appliance, that is the headgear, which is an orthopedic appliance, is incorporated into the twin block, which is a myofunctional appliance. So when we have a combination problem, we treat it with combination appliance by incorporating orthopedic appliance into the myofunctional appliance. So coming into the points what we have discussed, we have 4 skeletal class 2 component. When we have orthognathic maxilla with retrognathic mandible, we treat it with myofunctional appliance. When we have a prognathic maxilla with orthognathic mandible, we treat it with orthopedic appliance. When we have a vertical maxillary excess leading to increased lower facial height and gummy smile, during the mixed dentition, we treat it with the orthopedic appliance, that is the headgear. And we may sometimes have combination problem, that is prognathic maxilla with retrognathic mandible, which is treated with the combination appliance, that is myofunctional appliance with orthopedic appliance. We incorporate headgear into the twin block. I hope this video has been helpful, and next case onwards you will be able to treat the skeletal class 2 with proper diagnosis and proper appliance during the correct growth spurt. Thank you.